feel like I got hit by a truck. Like a truck just ran over your body. Every single part of your body hurts. You have no energy whatsoever.
I can't regulate my temperature, and the pain and burning is so beyond my ability to think and press through in other areas.
When the pain is that bad, sometimes, you know, it's just really hard to see any glimmer of hope out there.
I was hit with a baseball when I was 14 years old. It hit me right back in the face when I was pitching and broke my nose, shattered my cheekbones, and it led to CRPS in the face, upper body, hair, ears, all of that. But we didn't know that at the time. It took 19 years before I got a diagnosis. And
in 2004, I sprained my ankle, and I knew instantly that this was a different kind of sprain. The pain was just absolutely through the roof. An intense pain, like a burning beyond anything that I'd ever imagined, and then such a hypersensitivity, like I couldn't have anything touching me at all. When those symptoms started just randomly showing up in other limbs, it became, it was just a nightmare.
Initially you feel a little bit crazy because the pain is so strange. It hurts if you're sleeping or not sleeping, more appropriately. It hurts if you're sitting in a chair. It hurts if you have the affected body part elevated. It's kind of a stinging, burning pain.
For about 6 months, I kind of got passed doctor to doctor, trying to figure out, you know, what was happening. And I had 2 kids at home that were under 5, and, you know, trying to maneuver life and figure out what was happening. And I had no idea that this would end up being, you know, a journey that I would be going through for the rest of my life.
A lot of what you do is try to anticipate and react accordingly, but there are times where you can't, and you have to be sympathetic and understanding, and in many cases that's hard because you don't know what they're going through.
The hardest thing about raising kids when you have a CRPS, you have my dreams and my visions for them and for our life. You know, never changed. And you have to adapt.
Complex regional pain syndrome is characterized by pain that is disproportionate to the original lesion or injury or the healing process. That's in the mind of the doctor that makes the diagnosis. But it also is usually characterized by disturbance of the autonomic nervous system, or the automatic nervous system that controls blood flow to the limbs. It is thought that the early diagnosis and identification of CRPS is critical for successful treatment. It is a disease that never comes to us as specialists usually until 6 months. However, if at 3 months there is still delayed healing or disproportionate pain, it's time to start thinking about this and considering the possibility of a specialty referral.
I think it's the mandate of the primary care physician to say, do what you do, diagnostically and therapeutically, and if you get to a point that the patient is not getting any better, at least consider the possibility that you haven't gotten to the right diagnosis, which is not a criticism, I mean, because nobody's that smart that they know all the diagnosis and all the treatments.
The diagnosis of complex regional pain syndrome is not subtle. This is something that all doctors everywhere should be alert to, and the new criteria is simple and accessible, hopefully, so that primary care doctors can detect this early and refer to specialists if necessary.
How do people react emotionally to finally being given a diagnosis? And the answer is they cry. Okay, that's the first reaction, male or female, they cry, because it's almost like finally somebody understands what I'm going through. Finally somebody understands the disease. Finally somebody is going to offer me some help, that there is, you know, a light at the end of the tunnel.
Getting my diagnosis really changed my life.
Once she was diagnosed, You know, it was a relief because there wasn't this belief that it was all in her head. And so once we knew that, you took this little breather and said, okay, now what do we do?
You do have to change what you do and who you are. But that doesn't mean you have to not do anything anymore. You just have to do things a little bit differently. I think your life maybe is circumscribed by pain, but not defined by it.
You have to change the way you're living, but that doesn't mean you have to stop living.
The advice I would give somebody who was just diagnosed: take a deep breath. As this is going to be a journey, and it's going to be difficult, but they're not alone. Keep looking up and keep moving. Don't isolate. Reach out. Use your voice. You know, if it hurts, say it. You know, when it feels good, say it. Count your blessings, and don't hide. You know, don't be embarrassed or ashamed that you have complex regional pain syndrome. Like we have to stand out and speak up.